Good afternoon. This is Dr. Sonia Ehrhardt, Assistant Nursing Professor at Claflin University. I have been asked to speak with you about COVID-19. The Resource Center on the Claflin website, as you can see here, and this link works, has tons of information, and I suggest that you go to that frequently to check for updates. As I said, I am Dr. Sonia K. Ehrhardt. I am an RN, have over 30 years experience in the clinical field. I am also assistant professor in the nursing department. I have worked adjunct since 2016 and became full-time 2 years ago. What qualifies me to talk to you about COVID-19 and the pandemic that is currently going on? I have over 29 years of clinical experience, and I have over 20 years of infection prevention and epidemiology experience. I have certification in clinical surveillance of health-associated infections and the infection control professional as an environmentalist, and that was done through the University of Chapel Hill. I have won multiple state, national, and actually an international award for my work in infection prevention. I used to be director over the infection control department at the Regional Medical Center and worked very closely with Dr. John Sammies, who is an infectious disease physician and currently still works at the Regional Medical Center in that field, and have been in close contact with him during the coronavirus outbreak. A little bit about COVID-19. It's not a new virus. It has been around. You have heard of SARS and MERS. This is just a strain that we haven't seen, and so it's something that's kind of new. It outbroke in China in 2019. Symptoms are fever, cough, difficulty breathing. You may or may not have muscle pain and tiredness. The transmission is via respiratory droplets, and the incubation period is 2 to 14 days. And we'll talk about prevention a little bit later. We need to stop the spread. How do you do that? Recommendations to prevent transmission of all respiratory pathogens, and that can include influenza as well, is to wash your hands often with soap and water for at least 20 seconds. You may use an alcohol-based hand sanitizer, but it has to be at least 60% alcohol if you have no soap and water. It is best to use soap and water. You want to avoid touching your eyes, nose, and mouth with unwashed hands. You want to avoid close contact with people who are sick. Stay home if you are sick, or if you've been exposed to someone that has been sick. Cover your cough or sneeze with a tissue, then throw the tissue into the trash. Clean and disinfect frequently any touched objects or surfaces. So again, the symptoms are fever, cough, shortness of breath. Those are the symptoms. If you are having those, you need to seek medical attention. How is it prevented? Again, washing your hands often, the avoidance of touching your face, avoiding contact with sick people. Stay at home if you're sick and avoid others. And we've already mentioned the other items. This is also a workable link for you where there's a lot of informatic type stuff, your posters you can use if you need some to put up somewhere. I want to look at this from a global situation. So this is a site that you can go to, and I'm going to send this PowerPoint out so that you will have access to these links and you can just click on them as well. Now, you have to notice that there's a timestamp of March 16th, 2020 at 13:52. These numbers on both of these slides, I'm sure, have already changed since I put this presentation together. But this will give you the number of cases globally, the number of deaths, and the number recovered. And then you can drill down to different parts. I picked the United States, and it tells what was there at that time. But as I said, it changes very rapidly. WHO, the World Health Organization, also has a situation report. This is the site for them, and you can click on and investigate different things. This is just showing you where the cases have been. Again, it may have already changed. WHO also has a site called Mythbusters, and this is the way to access it here. A lot of people, there are a lot of rumors that go around, a lot of questions you may want to know. Some things are true out there, some are false. So someone asked me, could it be transmitted through mosquitoes? So you can look that up And of course it cannot, but you can find out what's true and what not by going to that site. The CDC is the best place to get a report from. And this is the site for the CDC. This just shows you the states that have cases. I think there are just 3 or 4 that don't. And also on the site, you can find things like this, how it spreads, symptoms. It goes into a lot more detail, what to do if you are sick, and frequently asked questions. This is just a picture. This was in the New York Times, just to kind of show the outbreaks in each state and where the main outbreaks were. And you can see in South Carolina, it was in Kershaw County and still remains the highest place of outbreaks for South Carolina. South Carolina DHEC situation report. This is another site that's really good to look up. You can click here and it will give you the numbers. Now this one isn't updated quite as frequently as some of the others. And one of the good places for you to go to find out how to prepare or take action at home or things like that, and you want to look under the frequently asked questions and then find the resources on how to prepare and take action for COVID-19, and this will pop up, resources for home, and then they have checklists and things to help you. And if you're having, just common questions, cleaning and disinfection, what to do if you're sick, what does your household need? This is the link to that so that you will be able to go there for those questions. Just some facts about COVID-19. Worldwide, WHO declared a COVID-19 pandemic. We all know that. There have been dramatic increases of cases in Europe. Within the U.S., the outbreak curve is similar to the European countries with about a 2-week lag. Stock market has plunged. We've all been hearing that on the news. This is just something to show you if you want to look at it. It's probably behind date now too. Ban on flights from Europe, an NBA season canceled as one player had developed COVID-19. In South Carolina, excuse me, there have been increasing numbers of cases. The governor has declared a state of emergency. Claflin has extended spring break and the likelihood to move to distance learning. I think that has actually changed and it's been decided that we are doing that. So check the site for the specific dates on that. And then in South Carolina, the hospitals. We have many task force working on ambulatory and inpatient plans, and the problem is maintaining staff. So they are working on that, hoping to not become overwhelmed. Now, this was done this morning, and it has already been updated. But in South Carolina, we have 235 negative tests. We are currently, instead of 28, we have 33 positives. We added 4 more. I think we're at 20 for Kershaw, 1 for Charleston, 1 for Lancaster, 1 for Spartanburg, 2 for Horry, 2 for Anderson, 1 for Greenville, 3 for Beaufort, and now there's actually, 2 for Lexington, and we've had our first death, and that was the Lexington one. We have a lot of people in self-quarantine. We just don't really keep up with those numbers. We currently don't have any cases that I know of in Orangeburg. There have been some that were on self-quarantine, and I think some that were tested that were negative. You're hearing a lot about social distancing, and why is that so important? I think now it has been decided that you should not be in a group with more than 10 people, and I think they are asking certain places to close, like bars, gyms, restaurants, and to try to stay home if you can, especially the elderly need to stay home. But we do need to keep social distance in mind, because as in Italy, the hospitals would become overwhelmed if we had all of our outbreaks in a peak like this. But if we do the social distancing, it may stretch out our outbreak and not overwhelm our healthcare capacity, and that's something that we also need to think about. General symptoms are typically of a respiratory type tract infection, fever, cough, shortness of breath. Fever may or may not be present. About 80% have mild disease, and 20% have more severe disease requiring hospitalization. It is hitting most elderly people or people who have comorbidities are at higher risk for severe disease. So we aren't really hearing of a lot of young people. It's more like a cold to them. I can't remember where I heard there were some. I think in Kershaw County, some of the new cases were a little younger, well, not younger, but middle aged, that had been exposed to someone who had been positive. About 20% of people who are hospitalized will require mechanical ventilation. And in some patients may present with GI symptoms. This was the beginning within China, some of the symptoms that the patients were having: headache, sneezing, cough, shortness of breath, breathing difficulties, and that kind of turned into kidney failure and then fever. Specific symptoms. On March 5th, DHEC put out an official update of criteria to use for testing, and that is that you have to have fever in all three circumstances or signs and symptoms of a lower respiratory infection, which would be a cough or shortness of breath. So you'd have to have that and one of these. If you've been around a person who have laboratory confirmed COVID-19, or the travel history to those notifications, or if they've tested you and there's nothing else, then they may test for COVID-19. How is it spread? Through the air by coughing and sneezing, close personal contact, such as touching or shaking hands, touching an object or surface with the virus on it when touching your nose and mouth. The transmission routes are through droplet, which that's how you're susceptible, possibly through airborne, direct contact, and indirect contact off of surfaces. The people that are mostly at risk are older adults, crowds in poorly ventilated spaces with sick people, and people with chronic medical conditions such as heart disease, diabetes, and lung disease. What do you need to know? Again, avoid touching your face. Keep social distance. That's less than 10 or less people now. Avoid contact with sick people. Again, stay home, cover your mouth, don't shake hands, don't panic. Go see your doctor if you're sick. What do you need to know about proper steps to hand washing? And that's listed here. You want to make sure, of course, you have to wet your hands, lather with soap, sing happy birthday to yourself. That gives you about the 20-second time frame, rinse and dry. You never want to touch the faucet that you turned on with your dirty hand. You want to use a dry paper towel or your elbow to do that. So what does all this mean for Claflin University? You need to stay informed. You'll be able to use those links that I've embedded in this PowerPoint and also the Claflin University Resource Center. Stay up to date on that. Wash your hands frequently. Follow CDC and DHEC regulation. And like I said, I mentioned those earlier. Trying to stay home if you can. Social distancing. And again, even this afternoon, this has changed. As of last night, it was don't be in a group with 50 or more people. Now it's changed to 10. So make sure you stay up to date. I am available for any questions you may have. You may contact me via email at Claflin, and that's sehrhardt@claflin.edu. If you have any questions, I'll be glad to answer them. Again, as I said, go to the site. George will keep that updated for you. And it has been a pleasure doing this PowerPoint for you, and I hope that all of you stay safe. Thank you.